What happens when we have these structural and social barriers, and we in the health profession are doing very little to dismantle those barriers? And we put the blame on the patient. What happens? That simply perpetuates all these inequities, and we in the medical profession are complicit if we don't start stepping up, taking a moral stance, and saying that we are going to do what we can to eliminate social and structural determinants, structural barriers to health. So that's so I started thinking about all those patients who are labeled non-compliant. And I started thinking about all that bias that circulates in the medical profession, about how we see people, and how it can't be anything with us, it has to be them. And I said, oh my goodness, we have to restructure our whole curriculum at Washington University. We have to start really teaching our students and our trainees how to deliver compassionate care. We have to get them into the community. And that's been part of what I'm doing, trying to really, and that's taking a whole new light, thank goodness.
Think about the opioid crisis that we're confronting today, and the president's remarks on Monday that he believed in the death penalty for drug dealers, which is one of the questions. What do you think about his recent suggestion that the death penalty should be used in the war against the opioid epidemic? And in the book and in the press that you've done about it, I think that you're a little bit on the fence still about which way this is going to break. In the sense of it could be that the fact that this is affecting, 64,000 people I think died in 2016, and 95% of them were white. The fact that this is affecting white populations so deeply is what leads sort of people like Ted Cruz or what have you say, like, this is my cousin, this is my brother, this is the face of the epidemic, in a way that we didn't see about the crack epidemic, for sure, right?
Which, by the way, people, if you ever have a chance to go back and read
yeah.
the stuff about the crack epidemic, it is so disgusting and racist and abhorrent. I mean, honestly, like, even just the most mainstream stuff, like the local news, it is astounding to revisit that period and the way that these human beings and fellow citizens and people in the throes of addiction were talked about. It is just, it is a mess. It is an absolute freaking disgrace.
Another that I had observed in the hospital setting was in labor and delivery, where a Muslim woman was actually, her hijab ended up falling off, and she was rushing into a C-section, and they ended up giving her a white hospital blanket. And so I kind of paired the experiences I saw in the healthcare setting in different departments, really, in different specialties, and said, we need to fix this. And so I ended up designing a healthcare hijab made from a bamboo jersey material, made sure that the length and the width of the material was appropriate, added in slits for employees, so they had stethoscope access, which also has now turned into mask access during the COVID-19 pandemic, and ended up approaching leadership and suggesting that they have this product after recognizing there was a need. And it was well received by health partners in Park Nicollet. And what happened in November of 2019 is they became the first healthcare system in the United States to offer hijabs to their employees and patients. And what that really did was start a conversation about what it truly means to be inclusive. I remember the day of the launch, we not only had Muslim employees purchasing hijabs, we had Orthodox Jewish women there and other communities who identified with the head covering. So for me, it was not only an opportunity to fill a need within my community, it's something that affected me personally, but it was an opportunity to also support and provide an alternative to other individuals who identified it with the hijab as well.
I'm excited about several things pertinent to equity that are happening within Mayo as well as outside Mayo. I would say one of the most exciting things that I get to participate in my role is partnerships. And partnerships across sectors outside of Mayo, not just within Mayo. One of the things that we are really looking forward to on that front is our recent assignment and how we've recently become the inaugural members or designatories for racial justice in business, which is a coalition by the World Economic Forum, where there is a coalition of over 48 organizations around 15 sectors, impacting approximately 5.5 million employees.
Wow.
I personally feel that this is how we need to do this work, not in silos, but really learning from each other.